Travis, let me start with you and your lawsuits against some of these manufacturers. We're going to put up the names of the companies that you sued. For example, Purdue. What sort of liability are we looking at here? Why are they liable, and what are the damages?
Well, thanks, David. Good morning. The companies are liable because they essentially manufactured this public health crisis and created it out of whole cloth based on their marketing practices that really began in the 90s when they were increasing and overselling the benefits of these drugs while underselling and really lying about the addictive nature of the drugs themselves. So you saw after that point prescription rates spike. Those prescription rates led to higher abuse rates of street drugs that are spin-off drugs from the opioid pharmaceutical products themselves. And all of that has led to what is pretty much universally acknowledged as now a massive public health crisis. So the lawsuits that we filed are on behalf of health insurance purchasers in several states who saw their health insurance premiums go up as a result of the costs needed to treat the opioid epidemic. There's also a large batch of litigation in federal court in Ohio from about 1,000 states, counties, and cities that have faced increased costs from Medicare, Medicaid, health care, public safety, and all of the other related government and taxpayer-funded costs of this epidemic that really was caused by the opioid manufacturers and distributors.
So, Travis, you and I both have enough experience with this to know most of these big, complex cases don't go to trial. They end up settling out. Is the liability here so great that these companies cannot afford to settle a lawsuit? And I specifically note, with respect to Purdue, there's been an announcement here that they've changed the chairman of the board to someone who is known as a turnaround kid, Steve Miller, who handled Delphi as well as AIG. Is there some prospect here that you can come to terms with some of these companies at least?
So in the federal litigation that's in Ohio, there are really two tracks proceeding in parallel. There is a track preparing some of those cases for trial early next year, really as a bellwether, an experiment, if you will, on both sides to see what juries will think about these claims when they're actually taken to a full trial. But at the same time, there is a settlement track, and there are negotiations that are ongoing as well. And the judge, Judge Polster in Cleveland, has said that he's anxious to move the parties toward a resolution. I think you're right that some of the numbers here are so large, it would be difficult to see how an early resolution would be something that all of the plaintiffs in these various cases would agree to. But time will tell, and those discussions are ongoing.
Professor Kruger from Princeton, you've done a lot of work on some of the costs of the opioid epidemic that goes way beyond the individual liability to insurance companies or otherwise. Give us some sense of what the opioid crisis has done to this economy.
Well, the Council of Economic Advisors released a report which estimated that the total cost of the opioid crisis is around $500 billion. That's $500 billion a year. The costs are quite broad beyond those imposed on the medical system. You also have the loss of life. 50,000 people a year now are dying from fatal overdoses related to opioid medication. You have loss of work. A large number of people, I estimate about 45% of the men who are out of the labor force are taking pain medication on any given day. About 2/3 of those are taking prescription medication. So there are tremendous losses for the economy.
Let's talk about possible solutions. Professor Kruger, let's start with you. We were told that there actually are some alternatives to these powerful painkillers that are not as addictive. Are those coming into vogue?
Well, we are seeing prescriptions decline. We're still seeing the overdoses rise. And I think some of this is the aftershocks, the after effects of the tremendous increase in prescription rates. And there are big differences across region. One point I would emphasize is if you look at the counties where the most opioids are being prescribed versus the least, the top 10% versus the bottom 10%, the difference is a factor of about 30-1. Fully out of proportion to the health differences across those areas. So I think we need to target our responses in terms of alternative treatments, especially to those areas where it looks like there's a tremendous amount of overprescription taking place.
Travis, is there any prospect that actually some of these pharmaceutical companies whom you sued could help with the solution? That is to say, really direct people more toward the less addictive forms of the powerful painkillers?
Well, I think with some of the supposedly addictive resistant drugs, it's a bit too little too late, and the effectiveness of all of those is not entirely clear. But the companies, to be sure, will be involved not only in paying money damages, but also as part of any injunctive relief, treatment programs, or other things that are set up as a result of this. But Professor Kruger is exactly right, and his research, if you look at that map of prescription rates, it's like a heat map for this epidemic across the country. It's totally out of proportion to the health needs in those counties and states, and it's really based entirely on these companies' marketing practices and where they directed their fire when they were sending their marketers out into the field. And so the companies will definitely need to be involved in those areas in particular and to be part of the solution here in bringing this crisis to an end.
We just looked at that heat map you were talking about that came actually from Professor Kruger. Why did they target those particular counties? Why is there that great disparity?
Well, I think time and some deposition testimony probably will tell, but the theories that are out there include economically disadvantaged areas where people who are coming out of the labor force for various injuries might turn to opioids. So think of manufacturing areas in particular. There's one story from West Virginia where a small town of about 3,000 people had 2 pharmacies, and over 10 years there were 21 million pills directed to those 2 pharmacies alone, and both the manufacturers and distributors basically were standing by and taking in profits while those kinds of numbers were happening and really turning a blind eye to it while taking the benefits.
So, Professor Kruger, if we start to have some kind of shift from less opioids and into, say, anti-addiction drugs, etc., what's the trickle down to the labor force participation rate in the broader economic context?
Well, I think that this is an area where the economy can truly benefit from an effective solution. And I commend the Trump administration for making this a priority. I wish they would stay more focused on it and be more aggressive in looking for solutions and working with Congress to find solutions. But I think we could see some recovery in labor force participation. Certainly, we would see a reduction in loss of life, which would be positive for the economy. So I think this is an area where improving treatment can also improve the economy.